Welcome to this page about the Lymphatic Lifestyle Solutions program that we offer here at Self-Care Therapy. I'm going to tell you a little bit about it. We are so excited now. We've been doing it for 2 years. I'm recording this video in January of 2022, and we're just getting ready to start our next class in February here at the office. Several classes have been through now, and we have had fantastic results. And I'm so proud of all the participants that have put in the effort and made the lifestyle changes and improved their lives. And I'm just honored to be a part of all that. So to the side here, you can see the pounds lost so far from the 2020 groups and from the 2021 groups. And the number keeps ticking up. What's really exciting is I'm still tracking many of the ones that were participating in 2020, and many of them are still losing weight. So you may see the 2020 number continue to go up, and that's because they're continuing to come in for follow-ups, and we get to see how they're able to continue. One of the arguments against many diets or lifestyle changes is that they only work temporary, but these participants are proving that they have been able to make sustainable changes and continue to lose weight and improve their health and improve their lymphatics long after the 12-week program is over. So I'm going to tell you a little bit about this program. If you want to see more about the results we got in the very first year that we did this, which was 2020, it was the year of the corona. It was challenging, but there's a video right below here where you can see more details on the results. Because the results are not only about losing weight. It's fun to see the weight go down, but what really matters in the end is how we feel. And if our lymphatics are improving, if our other chronic illnesses are improving, and you can see some examples of that. We're also doing quality of life studies with all our patients, and the quality of life improves for all the participants physically and emotionally, pain decrease. So it sounds like magic pill, but it's not magic. It's hard work and it's difficult. We all know it's difficult to make lifestyle changes. So this program was created by Leslie Keith. She's a doctor of occupational therapy in California. She has worked with lymphedema for over 20 years. She has studied the ketogenic diet. She's done some research on her own, and she's also compiled 2 books that really goes over a lot of the available research right now on the ketogenic diet and lymphedema. So when I came across her work and started digging into it, I was really excited because I've also done lymphedema therapy for over 15 years. I'm the owner of Self-Care Therapy, and we have seen over 2,000 people by now. We've helped with their lymphedema using the conventional methods with compression garment and manual lymph drainage, compression pumps, compression, stockings, bandages, all of that stuff. And that really works to bring the swelling down. But I've always known too that the strong link between lymphedema and obesity. And so I've seen these patients, hardworking, awesome patients, but they have struggled with trying to figure out how to lose weight, and sometimes because of bad advice. They've been told to try to go hungry or low carb, or low fat diets, and those are just so extremely difficult to do because who can go hungry all the time? Or they've been told to just exercise more. Well, none of that stuff has ever worked, so they get discouraged. And I've always wanted to be able to help them with that aspect, because if we can improve our overall health, if we can lose weight, reduce the obesity, reduce inflammation, then the lymphatics are going to be much healthier. And then we're really striking at the root of the problem and actually improving the lymphatic system, not just managing symptoms. So over the years, I've delved into life coaching methods because it's one thing to know what is the best thing to do. And now I'm convinced that the best thing to do is to go on the ketogenic diet. But I also know that it is important to exercise. It's important to get good sleep. It's important to manage stress because stress causes inflammation. So I've always been curious and delved into anything I could find on those topics. And most of all, the motivational psychology behind it. Because a lot of us know what we should be doing, but we just kind of guilt ourselves and say, well, I've tried and tried, but it's so difficult. We all know it's difficult to make lifestyle changes, but there's been so much research in that area too. So we don't have to reinvent the wheel. We can look at what works on a psychological motivational level to make lifestyle changes. What do people do that actually make lifestyle changes? What did they do? And if we can follow their example, and if we can follow the research that has worked. So we want to look at any research that shows and proves the results. And if we use those methods, we too can create those lifestyle changes. So I'm just here to coach along the way. I'm here to show those methods, to teach those methods, and to help keep accountability going, keep the momentum going, keep the traction going. That's my job as the instructor in this program and as personal coach to those that come in. So the way this program is set up here in the office is there's a class/group session once a week. It's usually on Wednesdays at 2 o'clock. I only run this program 3 or 4 times a year. So if there is a class coming up, you want to make sure you sign up for it. Here in the clinic, you will need a doctor's referral, which we can help you with. All the patients that we've seen so far have been patients in our office that have been treated here. Their swelling was reduced, but they wanted to go further with it. So once a week, group sessions in the office, and then once every other week, an individual coaching session. And those are hugely important because that's when we can really customize this program to make it work for you as an individual, because we all have different foods that we like and don't like. We all come from completely different backgrounds. I have people that are in their 80s all the way down to their 20s. I have people with multiple complications, with different chronic illnesses. We've had patients go through here with diabetes, with arthritis, with heart problems, no gallbladder, with the gallbladder. There's all kinds of conditions. We want to look at all of those. And we want the doctor on board to know that what's going on so that he can monitor the medications. I've had patients that have been able to come off of medications with their doctor's advice because their lab work have improved. You'll see in the results about one lady that completely came off of all her diabetes medications. She was on 40 units of insulin a day. It's possible, but that has to be monitored with the doctor. I'm here to coach along. So once a week sessions for 12 weeks, once every other week, individual coaching sessions. That's the office program. If you're watching this and you're not in the Wilmington, North Carolina area and you wish you could partake in this program, there are a few different options. Or if you live in this area, but you can't make the class, for those that can come in only for the individual sessions, there are video recordings available in place of the group sessions. So you can talk to us about that. If you live far away, you can click on the side here where it says online program. I'm actually working together with Leslie and Keith, the creator of this program, and we have put together an online program. It will start January 31st of 2022. So if you're watching this and it's past that date, click on the link and see what else we may come up with in the future to make this program available online outside of our service area. So that's it about the program. If you are local here, I really hope to see you in class. It has been so exciting. There will be more videos here too that will explain the research behind this and why the ketogenic diet. I'm going to put a video here where Leslie explains the research behind why a ketogenic diet can work for lymphedema and why it's effective for weight loss. So enjoy the other videos on this page and hope to see you in class.